Crying is a normal thing in babies since it is the language they use to express themselves, to tell us of their discomfort, they are hungry, and also attract attention from us as mothers. But when a baby cries for hours non-stop with no reason, they've been fed, they are not hungry, they are not sick, they are clean, they have nothing to give them a reason to cry, then it gives you worries as a mother, and most likely that baby is having colicky. Join me today as we discuss colic and what it is, or colic pains and what they are, the causes, the remedies, the signs and symptoms for this particular condition in babies. It is Shiphrah the Midwife, and welcome. Colic pain or colicky is a condition that babies get 2 weeks after birth, and this condition usually goes on up to, normally it goes on up to 4 months. Some extend up to 5, but rarely. So this is a condition that involves a baby going through cramps in their tummy, and usually it's because of various reasons, like we are going to see what could be the cause, but majorly it is because of the developing system of these babies. How do you get to know that your baby is then suffering from colic or colicky pains? The first sign is crying, unconsolable crying. It can be for 3 hours, at least 3 hours, or for 3 days, or 3 weeks and over. And this doesn't mean that the baby is crying non-stop for 3 days or for 3 weeks non-stop, but they have a fixed routine time of crying, and the crying is not as normal. That leads me to the next point, which is the difference in crying, because you could be wondering, my baby always cries, and I mean, how do I differentiate? The difference in the crying is the high-pitched and loud, extremely loud cry of these babies, and they do so non-stop. Most of the babies do the crying for 3 hours, usually at night, 3 hours non-stop, and it can be very tiresome and consuming for the mother and the father at that time, because you're tired, you want to rest. So it is not something that you can say you withstand, you can withstand or just put the baby somewhere and sleep. It is not possible. Then the next sign is that there is the consistency in the time of cry. They cry the same time every day for either 3 days or 3 weeks or even over. So they have that consistency of timing. If you have a baby that has been crying for 3 hours non-stop, try to track them and see, is it consistent? If they were starting at 9 p.m., do they still start at 9 p.m.? Or is it at the same time, like always? Is it repetitive? Like, does the cycle repeat itself? Then we go to the next one, which is posture. Now, the babies change their posture when they have colic pains or when they have an attack of colic. One is the arched back, like the baby's back becomes arched. I'm going to demonstrate that. They clench their fists and also have their legs curled while crying. Now you can imagine that kind of posture for a crying baby. It is not usually a good one. So at the time of an attack of colic pain to a baby, this is how they will be posture-wise. Their back gets arched like that, so their head is more so that way. Their back it draws inwards. They clench their fists. Of course, that is a clenched fist. So for those that could be wondering, that is how the fist of the baby will be during that time when they have colic pain. And then their legs will be curled. They will be curled inwards like that. The other sign is the physical sign, where you have your baby flushing their face. like they do that. It's like as though a baby, if you've ever seen a baby that has had constipation, the way they clench their face and make it, it's like as though they are in pain. Yeah, basically that is what happens to their face. And then they have frequency in burping. Yes, the baby has not like fed immediately that time, but they are over time burping. And then the last one is on that physical part is the tightness in their tummy, like their tummy gets tighter than usual. So those are some of the signs that we can use to tell whether it is colic disturbing our babies. After knowing all these signs, then the question that comes to us as mothers is, what is the cause of this kind of behavior in my baby? And I'm going to share the triggers that lead to colicky and the causes as well. So the first cause is the premature digestive system of our babies. When our babies are born, they have not had anything going through their digestive system. The first thing they are getting is, one, could be your breast milk. To some, it could be formulas. And all these are coming in, being introduced into the baby's system, which has not had them before. So there is a reaction that the digestive system gets when it gets into contact with the milk. So that is when they start getting cramp-like signs, and then the pain that comes with that. Of course, like mothers, you know, when you have cramps, it is that way for babies during this time. The next point is the gastroesophageal reflux. Now, most of us usually call this burping, or in my language, they call it okuboga. I mean, there are many things that we call it when a baby releases milk from their mouth. Especially, it's not vomit. It's not like they are vomiting, but they usually have that reflux. Now, that reflux causes irritation. I don't know whether you've ever had heartburn, but now it becomes that way for a baby. And of course, with that kind of acidity, it leaves the baby in discomfort and the pain as well. The other thing that could cause colicky is ingesting gas while feeding. Now, most of the mothers have been told to help their babies burp whenever they have finished breastfeeding. The reason as to why it is that way is to release or to relieve the gas that could have been swallowed in. When gas is formed in the digestive system of these babies, it causes flatulence. And because of that, they will have those pains. Poor positioning of our babies during feeding is also another trigger for colic pains. Now, our babies are supposed to be held this way while we are breastfeeding them, such that their stomachs are straightened up, not this way as though they are seated, because when you do that, the milk will stagnate in one place, and when they now get to the upright position, it will cause that discomfort and definitely colic pains. So try as much as possible to have your baby correctly placed or positioned during the feeds. Mothers are advised to breastfeed their babies exclusively for 6 months. And the reason it is so is because breast milk is the best food for our babies, leave alone having enough nutrients that the babies require at that age. It is also lactose free. Now, because of some reasons, our babies unfortunately have been introduced to formulas. Of course, these formulas usually are mixed with milk, which is cow's milk in most cases because it's the most affordable. And this cow's milk has lactose in it. Some of our babies are lactose intolerant, or their bodies are allergic to this lactose. So when you give them milk that is constituted with cow's milk, then it causes their guts to become irritated and obviously leads to colic pain. Of course, when we are pregnant, we are told to leave alcohol, we leave cigarettes, because they have an impact on our baby ultimately. Now, you would want, as a mother right now experiencing a baby with colicky, you would want to also reduce on the dairy products that you're taking, yogurt, ice cream, those that have milk in them, so that you check whether it could be the cause of colicky to your baby, or even completely stop them for a particular period as you monitor your baby during that time. Imbalance of gut bacteria could also be another cause to colic pains in children. This is related to the premature digestive system of your baby. Of course, we have bacteria that help us to digest food, and if they are poorly balanced, then we will have issues with our digestion. So that could also be another trigger for colic pain in your baby. What do you do when your baby is under a colic attack, or what are the things that you can be able to do to ease their pain? From a medical perspective, there are things that your medical assistant can help you do as a mother, that is your doctor or your physician, pediatrician, midwife, whoever is giving you care on the baby. They could decide to prescribe for you probiotics, which are medicines that have healthy bacteria in them that help the baby's intestine develop those healthy bacteria. And then the other one could be they could prescribe for you medication. Usually grip water is one that is prescribed to help the baby relieve the gas or deal away with the flatulence. The other one, of course, most of us that are feeding our babies on formulas, we have had to consult our physicians to help us get the best formulas for our babies. So if your baby was previously on a milk-based formula, then change the formula to a non-milk-based formula. Of course, you have to consult with the doctor for you to be able to get to this decision, if that is the cause, or to be certain that that is the cause of the colic pain. I previously did a video tackling 9 tips that a young mother or mothers should know during their care for their babies. And one of the things that I shared about was the natural remedy for colic. Now, that caused a lot of concerns and has propelled me to do this important video still on colic, for you to be able to understand it more. If you've not watched that video, then you might need to pause and go back and watch that video. The link is here in the description box, so make sure that you watch it for more other tips. Now, moving to the natural remedies for colicky, I had shared one, which was the use of activated charcoal. And most of the mothers were wondering, how do I use it? For activated charcoal, you crush it and put it into half a cup of water, drinking water, and then let it settle. Then take a teaspoon every other time you're going to breastfeed your baby. Let them have that teaspoon of that water before they have a feed. So I think that is clear to the mothers that had not gotten that point. The other is cumin water. Now, cumin is a spice that most of us have in our homes. So if you and if you don't have it, the spice is available in supermarkets. So basically, you're infusing a teaspoon of cumin into distilled water, half a cup, and then use that teaspoon of water, the water now that has come from the infused cumin, to give your baby 2 times a day. 2 times a day. This one is not given after every or before every other feed. This one is given 2 times a day. So I think I am clear on that point. And then the other one is fennel seeds. Now, fennel seeds, just like cumin seeds, you can easily get them in the supermarkets. Use the same trick. Get a teaspoon, put in a glass of water, let it settle overnight, and then start giving the baby twice a day. Then the other one is a warm bath. So give them a warm bath. This helps them to relax their bodies and would easily take them to sleep. And as you give them that bath, kindly massage their bellies as well, so that you can ease off that pain. The water is warm and it relaxes them at that point. You can only give a warm bath to a baby with colicky if they are babies who love bathing. So do not give a bath to your baby when they are having a colic attack and they do not love bathing. A tummy massage is also another thing that is good for your baby to relieve the colic pain. Now, this can be done with mustard oil, it can be done with coconut oil, it can be done basically with the healthy virgin oils that we can easily afford. So any of the oils that you can easily afford, and it is healthy, non-refined, non-refined oil, you can use it on your baby. Now, how do you do that? How do you do the massage? So I'm using this prop as my baby because my baby could not allow to be on this table for you to see. So I hope this can still work. We are going to assume that our navel is right here. So I'm going to put my finger there so that we have a point of reference for a navel. And then when you get that oil, it should be warm. It should be warm. It shouldn't be cold oil. You warm it. So you have warm oil, and then go around with your two fingers, these two fingers, go around the navel and do it in a clockwise manner. So you go around the navel like that in a clockwise manner. And then after massaging the navel, move this side of the chest or the rib cage and then back downwards like that. And then back inside close to the navel in a circular motion. And that the two fingers are enough for your baby because the baby is not that strong for a whole hand of massage. So that clockwise motion helps to deflatuate the baby's abdomen. It helps to relieve the gas that was in the baby's abdomen. So I think I'm done with the tummy massage. Other natural remedy is burp your baby. Burp your baby very well. Of course, like we had said previously, when we allow air to get into our baby's feeding stream, then we create that gas in their abdomens. So try as much as possible to burp your baby. Of course, when you are burping your baby, you will hold them this way to one of your shoulders and gently stroke their back like that. And naturally, the gas will just come out. They will burp on their own. There is nothing more that you can do. Or you could decide to put your baby on a flat surface, on a bed or on a changing table, and then sideways. I think I'll turn it this way so that you can be able to see. Sideways, and then gently rub their back as well. This could also help to burp your baby and remove all the excess air in them. The other one is tummy time. Now, tummy time has been a thing for some mothers, and for some of us, we have never heard of something like that. Now, what is tummy time? Tummy time is a time that you give to your baby to lie flat on their tummy. But this method of relieving colicky should not be done when the babies are having a colic attack. So what you do is you set up a routine for them every day to have at least 15 minutes of tummy time where they are sleeping on their back. And usually it is not usually comfortable for them, so you try as much as possible to be there with them, talk to them and distract them so that they can have those full, complete 15 minutes of tummy time uninterrupted. This is how you do tummy time for your baby. This, assuming this is my baby, and this is not there on a baby, on a normal baby. So this here is going to act as my pillow. So what you do if you do not have those round pillows, you can just form one with a blanket. Just roll it and fold it and make it in a bow so that it has that kind of shape. Then this will act as support for your baby's hands and the head and the neck muscles because they are not fully developed at that time. Of course, this one is too high for this baby of mine, but you make it low enough for the baby's tummy to lie flat on the surface. So you hold the baby that way, in that position, as you talk to them, because that helps even in soothing them. And then they do not usually love this position. So you try as much as possible to make it very exciting and interesting, and they will have time to have their tummies on the flat surface for those 15 minutes. And this will help in soothing them, and in long run prevent the colic pains. The other practice that you could do for your baby, this can be done when they are having a colic attack or not, is to have them do knee flexes. Now the knee flex is, I'm going to assume that this is my baby's knee. How do you do it? You take the knees and bend them. Hold the feet of your baby like that until the knees are bent that way, and then try and push inwards to the abdomen like that until you meet resistance from the abdomen. So you do that for 6 to 12 times, of course relaxing the baby, and then repeat that for 8 times a day. And that will help to deflatuate your baby or remove the gas that could be in their tummies. If you do this, it could also, you would hear your baby fart. So that is a normal thing, yeah, when they pass gas, and you should be happy when they do that. So that is basically knee flex, and it is going to do a great deal for your baby. Of course, you're doing all this to soothe your baby, but remember, the pain is not going to go away immediately. So you need to know how to handle this baby during this time. One of the things that you should do as a parent, though it is very hard during that time, is to attend to them. Attend to these babies. Give them your whole attention. Of course, when they are crying and they are that restless and uncontrollable and unconsolable, it becomes hard to give them attention. But try as much as possible to attend to them. The other thing is talk to them, reassure them. Even when you think they do not understand, your voice is soothing them, and before you know it, they will fall into sleep. You can also sing for them if you can. Sing for them lullabies, whichever songs that you feel your baby has always listened to. Create a culture of talking to your baby and communicating to them, especially now that they are in pain. The other thing you can do for your baby during this time is to carry them, stroke them, and rock them. That helps to soothe them, and they will be quiet within no time. The other thing you can do is to distract them. Give them a pacifier. Let them suck it, bite on it, because that also creates a soothing moment. And since there is nothing that is going into their tummies at that time, a pacifier is just going to be okay for them, and it will soothe them and take away all the pain that they have. When do you need to consult your doctor? After you've done all this and it is not working. One, when your baby has developed diarrhea, that is not a good thing. So consult your doctor, and especially if the diarrhea has traces of blood, you would not want your baby to have that. So do not wait for the baby to get to this point. Consult the doctor. When your baby develops fever that is 37.7 degrees Celsius, you need to consult a doctor, because fever in a baby is not a good thing. When your baby is not feeding and is losing weight or has stagnant weight at that moment, then you need to also consult a doctor. When your baby starts vomiting as well, you need to also consult the doctor immediately. When your baby gets sleepy all the time and is not active, you need to consult the doctor. She or he could be sick or injured. Among the many challenges that you will face as a mother, colic pain is one of the challenges that tests your patience, that makes you feel so down, that makes you feel like you've not done enough for your baby. And sometimes it makes you feel frustrated to a point that you do not want to see that baby at that time. This is my advice to you. Be patient, be calm, and soothe your baby. However difficult it is at this point, try as much as possible to do so. And please do not stop breastfeeding your baby. Thank you so much for creating time to watch this content. And if you found it helpful and the information there very good to you, kindly consider subscribing and also hitting the notification bell so that you get it in time whenever it pops up. Thank you and God bless you. Stay safe.